Justin Dean, my friend and colleague, you are in LA these days. It's so good to see you, man.
Yeah, likewise. I literally just moved into my apartment last night, so it's a mess here. So don't mind that.
Yeah, well, we've strategically oriented the camera so we can't see all of the boxes that are partially unpacked and stuff strewn about. But
Appreciate that.
I'm buzzing you here today to talk a little bit about the Fix Your Own Back course, the clinical companion to Fix Your Own Back. This is something that it's a process that you know quite well. We worked it together in the office for a couple of years or more, and you've seen how it works with patients, and you've had some success with it on your own out there. So I
Sure.
wonder if you got any a success story or something that you found recently where somebody came in and you were able to roll that model out and find that it really helped somebody.
Yeah, I actually had a pretty interesting case. Maybe actually about 3 days ago. It was actually a 38-year-old male that had left hamstring pain, and even on the phone, he was very adamant that he had a hamstring strain. For no trauma, no reason to have a muscle strain. And he was very adamant about having soft tissue work done and adjusting, particularly of his hips and lumbar spine. He asked for this specifically. And even going through the exam, he repeatedly asked, "Are you going to pop me? Are you going to pop me?" So we have the mentality of a very traditional chiropractic model, which is nothing wrong with manipulation, but that was the mentality that he had coming in. And I took him through the physical exam, and sure enough, touching his toes reproduced his hamstring pain. If we bent his knee slightly on that side, he could touch his toes without hamstring pain. The slump test gave him a red-hot poker in that hamstring. If we lifted his head, like we learned from Michael Shacklock, his pain actually was eliminated with the slump test. His motor was fine. Heel raises, toe raises, that kind of stuff, totally fine. Heel walks was totally fine. But the interesting thing is straight leg raise also reproduced his hamstring pain. And if I got him to get out of a chair, slumped over forward, causes hamstring pain. If we taught him to move like an athlete and keep more of a, what we would call a relatively neutral lumbar spine, where he's using more of his hips to move and move straight up vertically rather than using momentum to move forward, he had no pain standing up.
How about that?
What do you know? So, and the interesting thing about this, especially considering this Fix Your Own Back model, is he had no back pain. But it's very common that anything in the posterior compartment, hamstring, calf, foot, any of that range, you got to screen the low back. And this is exactly what you're going to be learning in the course, in the clinical companion course, is how to screen any possible low back contributing factors that could actually be masking a lower extremity problem. So sure enough, I did good old Fix Your Own Back protocols. We screened the lumbar spine via the McKenzie protocols. We did some static openers via Shacklock, and his pain was completely eliminated. I never manipulated him. I never did any soft tissue. I did a little bit of mobilization to make him happy. I mean, that's why I still keep this beard, because people think I'm young and stupid. So, and he walked away with his home care exercise because he wasn't very compliant. He wasn't buying into it. The only thing I really wanted to do was change the way that he stood up and sit down. And to berate the point to him, I actually had 10 times in the office. I had him stand up with a slouched posture, pain. Had him stand up with a relatively more of a squat-like pattern, no pain.
Yeah.
And I was messing with him, basically. At this point, I was driving home how he was moving was causing his pain.
Sure.
And the interesting little side fact about this guy is really interesting is he actually he's addicted to walking. This guy walks 7 to 10 miles a day.
Cool.
Yeah. So it's a little bit of an idea of what kind of forces we're dealing with. So absolutely, I would say that with the Fix Your Own Back model, is exactly the mentality that I would use to treat this patient.
So,
And
Justin,
go
if
ahead.
you don't mind, let me ask you. I mean, what you've described is beautiful, and we certainly see this with these patients all the time. Those that have been exposed to training in McKenzie therapy, MDT and such, would likely say, yeah, you know, that's just McKenzie. Um, how does the course differ? Because I know you've done McKenzie work as well.
Right.
How does the course differ, or what value does it add to that particular case scenario?
Well, one of my criticisms of McKenzie is actually that you just do prone press ups, which is basically like a sloppy push up for weeks and weeks and weeks. And I don't necessarily give somebody beyond 3 days.
Or you do a whole bunch of whatever
Right.
directional preference you establish.
Right. We use that as kind of to modify the pain,
Right.
but in reality, we're building capacity in the hip dominant movement pattern rather than a spine dominant movement pattern. So fix your own back is different because you're actually addressing, in my opinion, and according to the research, the core issue at hand, and then making and building a robust spine around that, which eventually leads into the functional capacity exam and beyond via McGill.
Right, and then as we'll talk about in the course, as you know well, we go beyond that and start to build strength, agility, and power in the back, starting to borrow from Stu McGill's work as well, and throwing in there all kinds of wonderful kettlebell correctives and things of that sort. So yeah,
Absolutely.
I appreciate it, Justin. Thanks for the time, and I really hope you're going to knock it out of the park down there in LA.
Just for anybody who knows, I'm in Valley Village in LA. So if you need somebody good,
there you go. There, I'll make sure that we put a link somewhere on here so that if folks are trying to find you down in LA, they can find you.
indeed.
All right, take care, brother.
Everyone take the course. It's worth it.
Thanks, man.